Hello, Dr. Ralph Napolitano. I'm with OrthoNeuro, a multi-specialty orthopedic and neurologic practice based here in Central Ohio. I'm our Director of Wound Care and Healing, and my area of expertise is the lower limb, which includes the lower leg, your ankle, and your feet. So arthritis, there's two types of arthritis, okay? We all, if we're lucky enough to walk the planet, all of us will walk the earth 4 times in our lifetime. Things wear out, so there's wear and tear type of arthritis. We call that degenerative arthritis, so that's one type. The other type, the other broad category is inflammatory arthritis. These are things like gout and rheumatoid arthritis. So treatment is similar yet not. So with respect to wear and tear arthritis, when we talk about the foot, we can accommodate foot deformities when things wear out, or we can do surgical options and rebuild certain areas that need rebuilt. When we talk about inflammatory arthritis, we have to get at that heart of inflammation first. So anti-inflammatory medicines, certain medicines that target that disease process. So for our gout patients out there, there are certain foods that can trigger your gout. Certain uric acid products are more rich in certain foods. So gout patients either make too much uric acid or they don't get rid of it in the right way. So with respect to your diet, there's lots of resources out there that you can look towards so far as a gout-friendly diet. So risk factors for our first type of arthritis that we mentioned, wear and tear, certainly occupations can put you more at risk. So periods of long standing, periods of a lot of increased activity can put you at risk for lower extremity arthritis. Repetitive, what we say, micro trauma. Of course, it's very good to be active, but not varying that type of activity can be a risk factor. Our other type of arthritis, inflammatory arthritis, our genetics plays a large role in that disease process. So we certainly have to keep that in mind with respect to treatment. Sometimes there's no choice but to manage that disease process pharmacologically with medicines and surgery. For both types of arthritis, that is, if you have a joint that's worn out, it can be replaced today, or to do surgery to reconstruct a body part to help accommodate those deformities that happen with either type of arthritis. So symptoms of arthritis, both the inflammatory and the non-inflammatory kind share similar symptoms. Joint pain, swelling, achiness, lack of function, all those things are part of both types of arthritis. When we talk about symptoms with respect to inflammatory arthritis, swelling becomes more apparent. Now, something to point out, wear and tear type of arthritis, that degenerative change, is non-inflammatory early on, but as the disease progresses and those joint parts wear out, it can become certainly inflammatory, and we can gauge our treatment based on those symptoms. Arthritis diagnosis is largely a clinical one at first, so what our patients tell us we can learn a lot from. So how their daily activities are going, how is work going, etc. The bone doctor's stethoscope, I say, is the X-ray. So an X-ray, I say, is like the bone doctor's stethoscope, so we can peer into the body and see those joints and how healthy or not healthy they are. So that's certainly an important part of staging arthritis, be it inflammatory or non-inflammatory. For our inflammatory arthritis patients, certainly blood work is necessary for diagnosis and treatment. So certain inflammatory markers and all of these things are necessary. So how we treat foot arthritis is based on the symptoms that you have. So if you have deformity, we have to accommodate those deformities, or if it requires surgery, we have to certainly intervene with surgical options. In my field, we do a lot of things with custom orthotics and certain shoe gear and activity modification. How we treat arthritis, especially in the lower limb, has to do with where we're at in that disease process. So early on, helping that foot function better. Certain things like orthotics, which are custom-made inserts for shoes or even over-the-counter shoe inserts, can be helpful, as certainly activity modification. So your day in, day out activities certainly play a role. We might need to modify how you go to work, what you do at work, and your recreational activities. Treatment's certainly focused on where you're at with respect to your arthritis disease process. So a lot of times we can look at a custom-made shoe insert to help that foot function better and feel better, or modify our shoe gear. Medicines, either by mouth or injected, are also very helpful, and we use these things a lot when we treat arthritis, both wear and tear and inflammatory. there's surgical options that we've referenced before. We can either remodel joints, replace joints, or fuse joints depending on what needs to be done with respect to where we're at with that disease process.